Welcome back to Smitty's Learning Room. Today we continue to have a look at how sports medicine meets the specific demands of athletes. And today we're going to have a look at female athletes. So when we have a look in the syllabus, we know that this content comes from the focus question, how does sports medicine address the demands of specific athletes? Now we've already had a look at children and young athletes and adult and aged athletes. And now we're going to have a look at female athletes. So if you haven't already learnt about children and young athletes or adult and aged athletes, make sure you go back to the videos which this content refers to. So when we look at female athletes, we're looking at these 4 issues here. So these issues are physiological changes, which include iron and calcium deficiencies, eating disorders and pregnancies. So today we're going to have a look at how do these things actually impact on females and what does that mean in relation to performance. So we'll start by having a look at the physiological changes. So the first one we have a look at is an iron deficiency. So when we look at this, we basically mean that the female body does not have enough iron in their body to function properly. Now iron is important because iron assists in the production of red blood cells, and we know from Core 2 that red blood cells actually carry oxygen, and when we're talking about performance, we need oxygen to be able to develop energy, and energy obviously allows us to perform. So if we're looking at iron deficiency in women, we look at the fact that they have an increased risk of low iron levels, and this is due to the fact of menstruation. So when women menstruate, they're obviously losing a lot of blood, which means that they can lose iron, and so their iron levels will be low. This is even more common amongst endurance athletes. Now, when we look at what are the issues relating to low iron, we look at this concept of anemia. Now, anemia basically means you've got a low red blood cell count. So if we've got a low red blood cell count, that means we've got a decrease in oxygen, which means that we're going to have a decrease in energy. So decrease in oxygen, decrease in energy would obviously mean a decrease in performance. So when we look at how do we actually deal with this issue of iron deficiency, a lot of female athletes will look at supplementation to try and increase their iron intake to ensure that their body has enough iron to produce enough red blood cells to allow their body to have sufficient oxygen and energy for performance. They can choose to either do that by 2 ways, either naturally or by synthetic supplementation. So obviously the first thing would to try and supplement that naturally with things like red meats, offals and green leafy vegetables and beans and lentils if they're vegetarian. And if it's a serious issue with iron deficiency, it might be a case of having a blood test to get this checked, and then obviously seeking assistance from the doctor as to which is the best way forward to ensure that the iron deficiency is dealt with and the iron levels are returned to normal. Something that's also important is that females need to consider their vitamin C levels, as vitamin C assists with the absorption of iron. So if an athlete is getting enough iron but they're not quite holding on to that iron, it could mean that they've got low vitamin C levels. So the next physiological change we see in women is a calcium deficiency. Now, calcium deficiencies lead to bone density. And when we talk about bone density, that's like how strong are our bones and how well can they withstand being placed through impact from sporting activities. And so females have lower estrogen levels, and because they have lower estrogen levels during periods of menstruation, this means that there's a loss of calcium in the body, and so therefore if we're not getting enough calcium to our bones or calcium in our body, our bone density is going to increase. Now, obviously here you can see that the strength of our bones or the density of our bones is highly dependent on calcium levels. So we have high calcium levels, we have very strong bones. We have low calcium levels, we have not very strong bones. So if we then look at this concept, well, what happens if we don't have strong bones and we have low calcium levels in our body? Female athletes are going to have an increase of hard tissue injuries. So this is obviously an issue for older or elderly female athletes, because we know that elderly athletes have low bone density as it is, but as a female elderly athlete, they are more susceptible than a male elderly athlete to hard tissue injuries because of decreased estrogen levels. And so obviously what we want to try and do for female athletes is to try and increase the bone density, and that's by increasing calcium consumption. It's really important for young female athletes to ensure that they're getting enough calcium so that by the time they're a young adult, their bones are strong. You can continue to do this by consuming products such as milk, cheese, yogurt, and salmon. It's also known that impact sports can have an improvement on bone density, but this obviously needs to be instructed by a sports practitioner or a doctor. So the next issue that we have a look at, which female athletes need to be careful of, is eating disorders. Now, when we look at eating disorders, these obviously affect male and female athletes, but female athletes are more likely to suffer from eating disorders. And there's lots of reasons around why female athletes suffer from such disorders, but generally it's because there are increased expectations for female athletes to look and maintain ideal body weight. And so therefore there's an increased chance of eating disorders amongst women. If we look at this concept in relation to performance, a decreased food intake or decreased nutritional requirements is obviously going to mean that there's a decrease in energy. And so if we have a decrease in energy, we're obviously going to have some form of decrease in performance. And so this is why it's important for us to have a look at eating disorders and how it can actually affect performance for women, and how do we actually support female athletes who are either suffering from eating disorders or looking at heading this way. So we'll start by having a look at some of the issues of eating disorders for female athletes. And so if a female athlete has an eating disorder, they're going to experience energy loss. Their bones are going to become weak because they haven't got enough nutrients. So we just looked at the concept of not having enough calcium or having a calcium deficiency. So if a female athlete isn't consuming enough nutritional requirements from foods such as calcium-rich foods, their bones are going to be weak. It's also going to lead to starvation and malnutrition. When we look at eating disorders in relation to bulimia, as opposed to just not actually eating with anorexia, we can look at things like teeth decay and dehydration. And we can also, there's obviously some things that are similar for both anorexia and bulimia, but some things such as irregular menstrual cycles and low blood pressure are some other issues that women who are experiencing eating disorders can suffer from. And so if a coach or a sporting practitioner can see that one of their athletes is actually suffering from an eating disorder, we need to have a look at ways that we can actually support that athlete, or how does sports medicine meet the demands of a specific athlete, and in this case, a female athlete with an eating disorder. And so first of all, we obviously need to seek medical assistance for this athlete in relation to a dietitian or a general practitioner. It's also important for sports practitioners and coaches to provide education for female athletes on dietary requirements and healthy eating. And this is actually a common practice among young female sports teams, often sports associations and organisations who run information sessions or days and around nutrition, which can actually provide athletes with the correct information to leading a healthy sporting life, as opposed to using unrealistic ways to maintain a required body weight or appearance for their performance. The coach and practitioner can try to develop positive self-esteem through positive role models. So they could actually, especially if it's female coach or a female manager, they can actually model positive behaviour in relation to eating and nutritional requirements. And also encouraging the personal best among an athlete rather than perfection. So sometimes if a coach or a manager or some person on the team is trying to get an athlete to strive towards perfection, this can cause an athlete to try and get to an ideal weight, or try and look aesthetically pleasing in relation to their event and their body, rather than looking at their personal best and what is physically achievable and realistic for them. So finally, for women, we look at this concept of pregnancy. Now, it's becoming quite a big thing in women in sport with pregnancy, and it's quite an ethical debate around, should women play sport when they're pregnant? Should they be playing high contact sport, no contact sport? Should they be active? And there's lots of different research around this area. And there's obviously been an increase in high profile sports women continuing to be active during pregnancy. So these are elite women who are on pro circuits of tennis and triathlon and surfing, who are actually competing while they're pregnant, obviously under very strict guidance from medical practitioners. And so we know that with exercise and being pregnant, the research suggests that if you do exercise while pregnant, you actually decrease the chances of cardiovascular disease, you decrease the chances of type 2 diabetes or gestational diabetes, and obviously decrease the chances of excessive weight gain during or after pregnancy. And then obviously some things that can happen from doing exercise while pregnancy are an increased self-esteem and well-being for the mother, or even the family around supporting the mother, and increased physiological function. So for example, if you keep the body moving, we're going to increase the oxygen demand, get the muscles moving, and keep the body healthy. So if a female athlete chooses not to be active while they're pregnant, they will lose physiological function of things like their muscles and their oxygen intake. And therefore, if they continue to exercise, and whether it doesn't necessarily have to be of a high level or a high intensity, they're keeping their body moving and functioning well. So a lot of the ethical debates around pregnancy and athletes competing while pregnant come around what sort of sports should they be playing when they're pregnant, and what sort of conditions should they be playing under. Now, when we look at sports such as non-contact sports like swimming or yoga, these are recommended throughout the entire pregnancy stage. And obviously any physical activity while pregnant needs to be monitored carefully by either your doctor or your sports practitioner, or even your coach. When we look at minimal contact sports such as netball, we can see that these sports are obviously of some level of intensity, but there's not a lot of contact to the athlete themselves. And so it's safe to say that these sports are okay to play during the first trimester of pregnancy. And then once the athlete goes into the second trimester, it's recommended that athletes no longer participate in minimal contact sports. Obviously, the participation in these sorts of sports would be at the discretion of a coach or a medical practitioner. When we look at high contact sports such as hockey or touch football or AFL, or even basketball, it's okay to do these sports in the first trimester, but it's heavily recommended that they only are played in that first trimester to avoid any contact from other players or sports equipment, which may cause harm to both the mother and the baby. When we look at what kind of conditions should women participate in sport under, they should try and avoid hot and humid conditions, obviously because the human body is going through change and there's a baby growing inside. If a female athlete is exposed to hot and humid conditions, this can obviously increase their chances of either injury or illness, but also from suffering things in relation to thermoregulation and body temperature. It's really important to ensure that the core body temperature is maintained during pregnancy to look after the child and to provide an optimum environment for the child to grow within the womb. Another thing that's really important for female athletes when pregnant is that when the athletes are pregnant, their hormones allow the muscles and ligaments to relax more, and so therefore they may be more flexible than what they're used to. And this can at times lead to injuries relating to soft tissue injuries around like dislocations or sprains, tears, strains of joints and muscles. So in summary, when we look at female athletes, they're different to other athletes because they're more likely to suffer from physiological changes such as iron and calcium deficiencies, from eating disorders, and from pregnancy. And it's important to understand the factors which contribute to these sorts of things, the signs and symptoms, and why they're an issue in relation to female athletes. And what are some of the things that, as a coach or a sports practitioner, how can they support female athletes who have an iron or calcium deficiency or an eating disorder, or athletes who are pregnant?